Hi, good afternoon. My name is Jean Guerrier. I want to thank SAGES for allowing me to present this case series on behalf of myself, Dr. Eid, the bariatric surgery team at Hackensack University Medical Center. I have nothing to disclose. Now, we all know the sleeve gastrectomy is now the most common bariatric procedure performed in the world. Several advantages worth noting include relative technical simplicity. In comparison to Roux-en-Y gastric bypass, there is no incidence of marginal ulceration, hiatal hernias, or gastric fistula. Also reported acceptable excess weight loss compared to the bypass as well. Causes of weight regain are several folds. That includes like weight regain or inadequate weight loss, which is defined as less than 50% of weight loss. These factors include initial sleeve size, sleeve dilatation, inadequate follow-up support, and maladaptive lifestyle behaviors. Laparoscopic re-sleeve gastrectomy has emerged as a viable option to tackle these issues, including insufficient weight loss and recidivism and sleeve dilatation as well. Now, this is a single institution retrospective study looking at 21 patients over a 2-year period. And the criteria for re-sleeve gastrectomy included insufficient weight loss, progressive weight regain, or weight loss with failure with the evidence of increased gastric volume as seen on CT volumetry of greater than 500 cc's. Primary outcome included weight loss, excess weight loss at 1, 3, and 6 months after re-sleeve gastrectomy. Secondary outcome included major complications that includes leaks, stricture, GI bleed, mortality over the 2-year period that we looked at. At the time of re-sleeve, the mean BMI was weight was about 126 kilos with a BMI of 42. About 90% of the patient had a re-sleeve for inadequate weight loss, and of the patients who had CT volumetry done, about 80% of them had a volume of greater than 500 cc. Some of the patients also had an upper GI double balloon study, which also demonstrated dilatation of the sleeve. Now, our study demonstrated no significant difference between the preoperative BMI and the postoperative BMI with the p-value of 0.83. The percent excess weight loss, the median percent excess weight loss was just above 27%, and that's much lower than the reported 61% in the literature. And that also comes with the complication rate of about 42% over the 2-year period that we looked at, and then the reoperation rate of 24%. Our reoperation rate for bariatric surgery at Hackensack is about 1.4%. So we do see quite a significant rate of complication based on the 2-year period that we looked at. Even dialing it back to the 30-day morbidity and mortality, we still have a higher percent reoperation complication rate compared to the reported value in the literature. So in conclusion, weight loss failure and weight regain after a sleeve gastrectomy is not uncommon and is a major concern for patients and the surgeon. Re-sleeve gastrectomy has emerged as a viable option to tackle these negative outcome, but unfortunately is associated with significant morbidity and mortality. It can still be an appropriate option for carefully selected patients. Obviously, this study is limited by our sample size, which is about 21 patients. A larger prospective study is needed to really assess the effectiveness of re-sleeve gastrectomy on a long-term follow-up.